So, all right, so it's been a long time since we've seen you, and it sounds like you've had your plate full.
Wow.
So let's go ahead and get these trimmed out. I'll go as gently as I can because I know your feet are... It's interesting, when I test it, you don't have any feeling, yet these are very tender.
Yeah.
Yeah.
I only feel pain. I don't feel, and like severe coldness. Now I felt that, but
Okay.
you think I would feel it more for how they are.
Well, you let me know if you need me to take a little break here.
Okay.
Okay. And once we get these trimmed and get you back on a regular schedule, they're not going to be this bad.
Wonderful.
Now you're covering your eyes. Is any of this hurting so far?
I don't want the visual to cause it to hurt more.
Would you like me to lay you back?
No, we're okay.
Okay.
Thank you, though. Did they grow straight, at least?
Yeah.
Well, that's because of your wonderful care.
Well, thank you. No, they're growing straight, but
Well,
down around the end of the toe.
they're under?
Well, it's growing downward at the end of the toe, yeah, curving down.
Wow. See, I can't focus at that distance.
Mm-hmm.
They actually have curled under?
Mm-hmm.
Wow. When's the last time you saw toenails this bad?
You'd be surprised. Every couple weeks I get somebody who, for whatever reason, hasn't been able to get in, or...
They've been neglected for a while.
Yeah, or someone bringing in a parent who, who thinks to look at grandma's toes.
Yeah, well, they don't do it in the hospitals and clinics anymore. It's,
All right, so I'm gonna come at this one with just little teeny bites. You let me know if anything I'm doing is hurting.
are we on the one by,
Next to the big toe.
yeah, that's,
Yeah.
I always wanted to curve in a little
Mhm.
when I could help myself.
Now, you're not doing any chemotherapy now, right?
Right.
It's just from when you were, all the nerves in your feet are kind of shot.
Yeah, 7 years.
Okay.
They did chemo and radiation. And back then, they didn't target just the tumor. They gave it throughout your whole body.
Mm-hmm.
And so now the last 4 years has been dealing with the side effects.
All the fallout from, yeah.
Yeah.
Well, we poison you just enough to keep you alive but kill the tumor.
Yeah. Yeah, I don't think I'd probably be here because I had stage 4 breast cancer
Mhm.
and then stage 2 rib bone
Oh,
tumor right underneath it.
Mm-hmm.
Yeah, and now all 4 of my children are in their 20s and they just got back from Bavaria for a month.
Now you have an ex who's there, if I recall.
Right,
Okay.
yeah,
And you had at least one of your kids went there to live with him, right?
right, yeah.
Wow, that's not bad. And I don't even have those notes in the chart, but I do remember you talking about that last time,
Yeah,
And you-
and now...
18 months ago.
Right. Yeah, and they just got back on, well, yeah, about 8 days ago.
Mm-hmm.
And they were all 4 of them living in the 2 homes in Bavaria. So they got to go to North Schwanstein and, of course, the Oktoberfest in Munich. And
Oh, fun.
they went and saw a concentration camp. And
Not fun.
no, that's
It's a very somber day.
very, yeah, you can feel the emotions there even though they're gone,
Yeah.
and retrace where they went to kindergarten and all that.
Mm-hmm.
And I was glad they all could do it before I'll start getting married and having babies, and that they all could for a month, be over there with that.
Together.
Yeah, that was a little scary on my part because I was left home all alone. But I wasn't going to have them drag me all over with them and then have to deal with my ex. No. But, yeah. And I'm just happy we don't have a ton of snow.
Yeah.
My wheelchair's broken and I'm walking with 2 canes on my hip and this is the most I've walked from the front of your door into the office here in, I don't know when the last time.
Well, we can get your wheelchair in here. The office can accommodate that. So I just want to show you, I don't know if you can see, but there's big dents down here in the skin where that nail was.
Oh, really?
Yeah, it was digging into the skin pretty good. Now, it doesn't look like it broke the skin,
Oh,
but
thank God.
but that'll, you know,
Be tender.
no, it'll feel way better
Oh, good.
now that we've got that nail not digging into the skin. So it's just
Well, I thought if it might be breaking the skin that you think that would be enough pain to, for me to notice.
well, that would make sense. That's why your ankles and heels are hurting.
You think? Oh, see, this
Are
is
we
the
able?
worst.
Okay, so I'm not going to try and move that then, because that's the hip that's.
Well, I can go
No,
this
no,
way.
you're fine. Just
Okay.
go so you're comfortable.
Yeah, when they took, I kept saying I was having pain, so much pain here.
In your hip.
Yeah.
Yeah.
And Dr. Zephyr, he went and did all the x-rays and scans, and he's like, well, when did that happen? It's like 1 minute it was okay and I was doing therapy, and the next
The bone is dead.
the bone's dead.
Yeah.
Oh, this one's so much worse than the other one.
Okay. This foot or this toe? Because this toe's almost done.
Both.
Okay. Well, like I said, you tell me if you need me to take a breather.
I'm
Stop for a
breathing.
minute.
Okay. You're awesome. I'm just gonna keep breathing and not watch. I don't have any type of bacteria or
Fungus or, you know, it doesn't look like it to me, but that's not your biggest issue right now. We can just keep these managed
okay.
and comfortable for you
Yeah.
without having to talk about
Other problems.
more treatments or other medications, right?
Okay. Yeah, that's the ankle they broke twice in 1 week too. This whole leg is my dominant leg in it. It's the one I have the most issues with. And then you were my miracle with broken ankles and oh, you have been through so much with me.
Yeah. Nice big chunk there.
But if you hadn't have taken care of my feet all these years,
Mm-hmm.
I don't think those toenails would have grown. I bet they would have probably already have been cutting in to the skin and everything.
Mm-hmm. Well, let's just try and.
Ooh.
Okay. Oh, hang on. Breathe. Okay. Done. Okay. Last one.
Really?
Mm-hmm.
Almost a little lightheaded. I'm such
Oh, yeah.
a wimp.
Okay. Well, let me get this last one done. If you need me to lay you back, I can. Slow, deep breaths. Okay, great. All right, I'm just gonna... All right, so we're just gonna use a regular old emery board on you,
Okay.
because I don't think you would tolerate the drill at all. Maybe next time when they're not quite so sensitive.
Always. And I don't give up, but
So I'm just gonna
I'm
go
not
real
getting
lightly.
younger. I'm not getting younger. Definitely not getting more flexible.
Yeah, that's what you got me for now.
Yeah.
So let's just get you back on a regular schedule.
Awesome. Oh. It's better if I don't. I think the eyes actually can cause more drama.
Yeah, that, that's true. Oops, I just knocked your cane over.
That's hard. It has to be. I can't even buy a cheap purse. Cause I'll wreck it in a week. The zipper will break. I had to buy all leather ones. Wow.
I didn't hear one swear word come out of your mouth.
No.
You did well. Okay.
No, I didn't go to hell and back. Wow. The fact that I can actually feel something a little, it's not normal, like I can feel my fingers in my hands,
Mm-hmm.
but that I can even feel a tiny bit of pressure.
Mm-hmm. I mean, look, any of this could have been caused by the chemo, it could have been caused by the Guillain-Barré syndrome, it could have been caused by the radiation, so you do definitely have feeling in your toes, because it hurts, right?
Right.
But,
But they're so cold, and when they get cold, that's when I feel the pain.
yeah, your circulation is not great
Right.
in your feet, again, chemo, radiation, all
Right.
of that. But you know what, but they look okay. I don't see any problems in the skin. We'll keep those nails, we'll keep them shortened.
Okay.
And, let's get you back in about 10 weeks.
Yeah.
And we'll take it from there. Can you get your shoes on, or do you need help with that too?
I need help with that.
No, that's
It's
fine.
this.
That's fine. Oh, I like these.
My Uggs. With the edema.
Mm-hmm.
Once you get them on, then I can pull. With the edema, I had to find boots that would,
Expanding.
right, with the swelling. And
I'll let you pull those on.
of course, they're the most expensive boots, the only ones that work. But I've always been that way.